Nisha the PA, we are live.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today I'm doing one of my favorite lasers that we use for acne scarring and overall rejuvenation. This is the Halo laser. Now I'll kind of show you a little bit about the laser as I'm doing treatment on my beautiful client. As you can see from the left side of her face, she has a little bit of acne scarring that we're working to improve. Now remember that Halo is a great laser in treating scarring. It's an ablative laser, and essentially what it's doing is operating at dual wavelength. So there's a superficial wavelength of the Halo machine. That's what's causing these little white dots. But there's also a deeper part of the Halo that's causing more of the redness. Now, she's going to see immediate results after treatment. Downtime is going to be anywhere between 7 to 10 days. But because Halo is operating on dual wavelength, she's also going to continue to see results of her machine or of this treatment over the next few months. Now remember, a part of doing lasers here at the office is that we like to combine multiple treatments to really help you achieve your goals. So prior to getting this treatment done, she had a little bit of Bellafill to her acne scars. That's why you see a little bit of pinpoint bleeding. The Bellafill is a permanent filler, which we use to pop up acne scars and to really help when we do our resurfacing lasers. Like in this particular case, we're using the Halo device. Now, the name of the game is all about creating combination treatments, making customized treatments for each one of our clients. So after we get done with the Halo laser, we're also going to do a little bit of CO2, a little bit more aggressive resurfacing to her scars. And that combination treatment, she'll get 20 to 30% improvement each time she gets it done. Now, I like to tell my patients all the time, Halo is a great device, right? We're operating at dual wavelengths. This is for acne scarring, overall rejuvenation. But taking care of your skin and treating your skin, it's like going to the gym. You really have to be very consistent with treatments. So what I recommend is that you do something like a Halo device where we're operating at the dual wavelength every 6 to 8 weeks. And then as your maintenance, you want to go in and you want to do your maintenance lasers. Now let me show you guys something really quick. These are all the dead skin cells. So the little white dots that you see, these are all the dead skin cells that are being sucked up in the device. And every now and then we have to go through and wipe it off. So I'm going to get some help. You're going to go through and wipe off the dead skin cells. This is going to make sure the laser continues to operate at the highest standard. And now after I got done wiping the dead skin cells out, watch how loud the laser is now. So every now and then we have to go in and wipe those dead skin cells off, and then we continue treatment. Once again, Halo is a dual wavelength device. This is great for a lot of skin tones when we're talking about treating acne scars or doing overall rejuvenation to your skin. If you have some texture irregularities, Halo device is a really great device for you. We like for you to prep with a chemical peel prior, because remember, we take care of your skin from the very beginning all the way to the end. So you want to prep with a chemical peel. You'll have your combination of laser devices depending on what we're trying to treat. That's going to be specialized to you based on your skin tone, based on your goals. And then what we do is we have a skincare regimen that you're going to follow as you continue to heal from your laser device. And make sure you know kind of the process you're going to do as we're taking care of your skin over throughout the summer and kind of into the fall. Now remember, you do not have to wait until summer is over to do laser treatments. As you can see, you can do treatments now. It's towards the end of the summer. And that's because we have a really amazing team here that will put together a complete regimen for you to make sure you know how to take care of your skin year round. We can't just wait till summer's over to take care of our skin. The same way we can't wait till summer starts to take care of our summer bodies, right guys? You kind of got to have to prepare for it year round. Now, we're almost done on this section of her face, and as you can see, compared to the left side, it's a little bit more red. That's kind of what you're going to expect during treatment. It's a little bit swollen. All of that will improve over the next few days as she's doing her skincare regimen by her skincare and our esthetician here. She has her plan written out. Almost done. Last time, she's doing really, really good. Now, Halo can be a little bit spicy. So in this particular case,
Nisha, what's the procedure here exactly?
we're going to go ahead and wipe that off. So this is the Halo laser, hybrid fractional laser. This is operating at 2 wavelengths. We have a superficial wavelength that's creating the little white dots. And then we have a deeper wavelength that's creating more of the erythema and the swelling. So the white dots, those are going to eventually slough off over the next few days. Those are going to give her the immediate results. The erythema that's caused by the deeper part of the laser will continue to encourage her acne scarring to remodel. Now look at her face, left side compared to right side. This is a treated side. This is the side that I'm going to treat now. So you can compare and see exactly how you're going to look full face, a little bit more red, a little bit swollen.
Is this a subcision or fractional? Is this a fractional ablative laser right now?
There you go. Now remember, subcision is when we go in and actually break up the acne scars. So this isn't subcision, guys. This is a fractional laser that we're doing to resurface her acne scars. Of course, depending on your type of scar, we may need to do subcision. Those are going to depend on the type of scarring that you have. If you have more deeper, wider scars, sometimes we have to go in and break up the scars, and then we use a little bit of Bellafill, which is a permanent filler, to go in and pop those acne scars up. In her particular case, we did use Bellafill because we need to pop some acne scars up. And now we're going over the Bellafill and we're doing a stronger resurfacing treatment. And on top of this, because we're really innovative here and we love to combine treatments to really help our clients achieve their skincare goals, we're going to go even stronger on her cheek after this and then do CO2 lasers for an even more aggressive, stronger acne resurfacing in her particular case. Now, that treatment plan will differ depending on what type of acne scars you have, depending on what we're trying to treat. So for example, if you have more ice scarring, then you want to use a little bit of PCA cross that will help to break down that acne scar. And then you can do lasers right on top.
Someone's asking, is it painful? What about anesthesia? We just do topical numbing and nerve blocks right here. Someone said, great work. Tried all of these procedures and it worked wonders for me.
Awesome. Love it. Now this is the thing. We cater every different or our combination treatment to each individual patient. So if you want like a more detail, like what about my acne scarring, or what about, you know, what treatment would work best for you, you can always have a virtual or in-person consultation, either with myself, Dr. Emer, one of our amazing treatment coordinators, or if you just want to develop a skincare routine, we have a bunch of amazing estheticians in the office that can help you achieve your goals. Remember, we do laser treatment here. We also do body. We can really get you together from the top all the way to the bottom, guys. Now, remind you, we're doing halo laser. And this is a hybrid laser that we're using to resurface her acne scars. You can kind of hear the laser. And what it's doing is working at 2 different wavelengths. There's a superficial wavelength. So look at these little white dots. That's the superficial part of the laser. Those parts are going to slough off over the next few days. And so she's automatically going to have improvement of her acne scars. But the great thing about the halo laser, because it's a hybrid laser and it's also operating at a much deeper level, she's going to continue to have improvement over the next few months. So what she's going to notice is that her skin is just going to keep getting better and better and better. And that, honestly, that's the optimal time to continue your laser treatment so your results can continue to build off of each other. Now watch this. Look at all the dead skin cells that are being sucked up from the laser. That's why the laser starts to sound a little bit weaker, but we're going to go ahead and wipe that off, clean that out, and then watch how much louder the laser sounds. There we go. That's exactly what we like to hear.
All right, guys, we're going to let Nisha, the PA, wrap up her treatment. We're going to come back next. We're going to do our CO2 treatment, which is going to be our stronger ablative laser with Dr. Emer.
All right, guys, Nisha, the PA, over here at Dr. Emer's office. You guys know how to get in touch with me. First name, last name, phone number, email address. Slide into the DM. Ask for a consultation with Nisha, the PA. I would love to take care of you here in the office. I would love to help you achieve your aesthetic goals. Until next time, bye, guys.